we in the health policy and management field talk about system. So that means having the structures on the ground ready, and if they're strong, and if you have a plan, you will be able to respond to it. So since the beginning of the COVID-19, as we saw it sort of spreading and emerging as a major crisis for the US, I was really surprised with the shortage of ventilators or the masks or the protective equipment. So those are very interesting things, but at the same time, we were talking about the shortages of personnel, significant important medications. So if you look at US from a bigger perspective, we should have, or we do have hospitals, we do have very well trained personnel, health workforce. We have an innovative drug sector in terms of developing medications and also producing protective gear. So as you can see, we had the components, but they were not at the right place at the right time. So that tells us that we have a systems issue, and there were massive inefficiencies in our healthcare system. So COVID-19 really highlighted these inefficiencies. So number one, they can play a role in triaging, meaning that they, for example, if you think about what is the significant role of primary care, it is the long-term relationship and getting to know your patient. So that's what they do. They know you when you were born, and they know your family and your siblings. So that kind of long-term relationship means that they also know which patients are vulnerable to COVID with pre-existing conditions, who are older, who have immune sort of diseases. So they can reach out to those vulnerable groups and maybe educate them about COVID, maybe monitor them. So in terms of this targeted approach of protecting the vulnerable, primary care is a central point. Then in terms of testing, they could be very helpful too. Of course, this assumes good testing capacity, which is a different topic. But if we have enough tests, the primary care providers can play a massive role again in terms of working in the front lines. Then let's say the patient is positive, but patient isn't very sick. So COVID-19 patients, this is a very interesting illness in the sense that some of us really have mild symptoms and some of us are very sick. But there's also the middle. There are some of us who seem to be mild and then deteriorate very quickly. So who would be observing this? I think primary care providers have a very important role to play in that kind of monitoring. They should be supported with technology like telemedicine, with protective gear, with some kind of innovation in the way that they provide and reach out to their patients. But I think primary care providers can have a huge role to play in terms of the treatment. We need to think about what a strong healthcare system looks like. These types of crises come and go. So it's the COVID-19 this time, or it could be another infectious disease next time. But remember, we also have non-communicable diseases. We have all the other kinds of challenges in the American healthcare system that present themselves and we have to respond to. So by investing in our healthcare system and having this holistic view about what our system looks like and what a strong healthcare systems look like, I think we will be able to, in the long run, respond to whatever comes next. Universal health coverage, when we first hear the term, often people often think about insurance. And insurance is very important, and COVID-19 showed also the importance of insurance coverage. But universal health coverage as an idea, as an agenda, goes beyond that. So it's defined as all people receiving necessary health services without suffering financial hardship. So it's definitely a financial protection. It's definitely accessing good quality healthcare services, but it also has this wider, if you will, goals in terms of healthcare as a human right, healthcare as a driver of social justice and inclusive economic growth. And the bottom line is, if we use it well, universal health coverage as an agenda will help us promote a comprehensive and coherent approach to health. So that's kind of my point about having a systems-based approach, having a holistic approach, which will help us identify these weaknesses and these gaps and the fragmentation and fix our system, right? So individual pieces are important, like health workforce, like equipment, like drugs. These are all very important things, but it's also a systems issue in terms of how these are connected and what's our long-term plan in terms of our system.